Dr. Brian Cole. I'm a professor in the Department of Orthopedics and associate chairman for the Department of Orthopedics. I'm also the managing partner of Midwest Orthopedics at Rush and the department chair of surgery at Rush Oak Park Hospital. You are listening to Interview with the Surgeon with the Surgeon Agent.
On this episode of Interview with the Surgeon, we welcome Dr. Brian Cole, professor of orthopedic surgery at Rush University Medical Center in Chicago. In 2015, he was appointed as an associate chairman of the Department of Orthopedics at Rush. In 2011, he was appointed as chairman of surgery at Rush Oak Park Hospital. He also serves as the head of the Orthopedic Master's Training Program and trains residents and fellows in sports medicine and research. He lectures nationally and internationally and holds several leadership positions in prominent sports medicine societies. He has published more than 1,000 articles and 10 widely read textbooks in orthopedics and regenerative medicine. Orthopedics This Week has named Dr. Cole as one of the top 20 sports medicine, knee and shoulder specialists repeatedly over the last 5 years as selected by his peers. He is a head team physician for the Chicago Bulls, co-team physician for the Chicago White Sox, and DePaul University in Chicago. Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Brian Cole, professor and associate chairman of orthopedics at Rush. Doc, how are we doing today?
I'm doing great. Thank you for having me.
Thanks for being with us. So let's just jump right into it. What were your goals and aspirations during your residency, and how did those change throughout your fellowship?
I want to commend you for this initiative. I think it's awesome. It represents a lot of things that I love to do day in and day out, and I think you're spot on with what you're trying to do here. So congratulations, and I'm honored to be part of it, especially having seen some of the other people that you've had the privilege to interview. So in residency, obviously, as an orthopedic surgeon, we do an orthopedic surgery residency. You kind of move along the 4 or 5 year process to figure out what you want to do when you're all done. And I didn't know early on, I kind of gravitated towards sports medicine. So once I honed in on sports medicine, I used, my training was at the Hospital for Special Surgery in New York. And I had always had an interest in academics. So that sort of came first. But once I gravitated towards a subspecialty of sports medicine, that kind of paves the way moving forward towards applying for fellowship, which I ended up doing and completing in 1997 at the University of Pittsburgh. So I had 4 or 5 years in New York at the Hospital for Special Surgery, and then did a year of research in basic science there, and then a sports medicine fellowship. And as a resident, you're most of us are very open-minded, and the goals are just to do as well as you can. And it's pretty simple. It's like a continuation of school. You want to do as well as you can in your rotations. Never want any doors to close because you didn't try hard enough or do well enough, quite frankly, because that's pretty much in your control or my control. It's the same tenet I think people exercise when they're in school, trying to get into medical school and then trying to get into residency. So I really wanted to do as well as I could, even without knowing what I wanted at any given time. And then it was doing as well as I can to get into a good fellowship, which at that time it was the sports medicine fellowship at the University of Pittsburgh. So honestly, my goals were to get as good a training as possible, to keep the doors open and plan for my future for whatever jobs would be available after my fellowship.
So during that fellowship year, can you kind of take us through your mentality heading into your first job search and how that perspective changed in the beginning years of your career?
I was a little bit unique in that, and I see this now with the fellows that we train, I was very lucky that I actually had a job offer before I started my fellowship. And that's not common, but I do see it from time to time. And as managing partner for my group at Midwest Orthopedics at Rush in Chicago, we will seek people who are in their fellowship and sometimes even residents, but under the pretense that when they're done, we would like them to join our group. During the sports medicine fellowship interviewing process, I interviewed at probably 8 to 10 programs, and I am from Chicago and not necessarily desirous of coming back to Chicago at that time, but it seemed like a palatable idea. And when I interviewed at Rush, I interviewed with the sports program for the fellowship with Dr. Bernie Bach, who was then the leader of the program, and now it's Nick Verma. And he was just an amazing guy. He is an amazing guy. And I said, look, I don't want to train there, but I certainly would contemplate, if I come back to Chicago and a job is available, joining the Department of Orthopedics at Rush, Midwest Orthopedics specifically. And I think I was one of the first out of residency hires. So when I went to my fellowship at Pittsburgh, I think I had already signed my contract for my job in Chicago, which is like the best case scenario, assuming it's a good job, because you go through fellowship and you don't have to worry about the job search. So I might have been a little bit of an anomaly because the job search can be very stressful. I work with our fellows now. We train 6 people a year, and They usually spend the first half of the year trying to find the kind of job that they think they've been looking for. But my job, I knew I wanted sort of an academic private practice. I didn't want to be a hospital hire, and I didn't want to be in a small private practice group. And I did look at different programs. I went to University of San Francisco. I looked at a private practice in Palm Beach. I looked at some things in New York where I was training residency. And the Chicago situation was ideal because it was in a growth trajectory that I felt that I could plug in with my interests at the time and hopefully achieve the career that I seemed, to be pursuing at that time.
So during your career, did you ever consider going private practice, or were you focused on academic all the way?
I didn't want to be just academic. When I went to medical school at the University of Chicago, I applied for the MD MSTP program, which is an MD PhD program. And I'm not necessarily all researcher, but I'm not all clinician either. And at the time, one of the things that made me gravitate towards orthopedics is that it has so much available from a basic science and translational perspective. In other words, it is one specialty in medicine that you can go to the office each and every day, identify a clinical problem, potentially take it to a lab in a test tube or an animal and or clinical study, and then come back in short order and actually have a different decision or solution for a patient. So it was very pragmatic, and there were just a tremendous number of translational research opportunities. That's why I liked orthopedics. And I ended up getting out of not doing the PhD program because I learned early that you can actually do research and not have a PhD. So I didn't want to honestly spend extra years. I'd already spent a year in basic science research at special surgery I was planning on doing. And I went during my medical school for my MBA in health administration. So that was 2 extra years before my fellowship. So 4 or 5 years for a PhD just didn't seem palatable, to be honest with you. And I didn't see the value for me because I knew, because of the role models I had seen, that I could also do research. That being said, I've been very business minded. Those who are coming out of residency and fellowship really need to understand that what you do will be a business. You'll have less decision making and control if you take a hospital job. That's just the nature of it. But for some, that's very palatable. You show up to work. There should be patients there. You don't have to worry about the minutiae day in and day out of running a practice. But for me, that was never really a consideration. I always had my mind on business, on service, and education. And the only environment for me that would present that opportunity would be a private academic opportunity. And there are not a lot of those out there, but they're heavily sought after because those who are like me, who have an interest in being clinically excellent and busy, and those who have an interest in doing research and educating residents and fellows, and then who have their eye on sort of the business of medicine, that's about the only environment that I think you can embody all of those things, if that's the balance you choose. And this environment in Chicago it was pretty apparent to me day one that it would afford the opportunity, if I pursued it, to allow me to engage in all those things. And truth be told, over 23 years, that's exactly what's happened. I've been really blessed in that regard.
What would you say were some of the keys to your success that shaped your early career as you climbed to the top of the industry?
Well, I kind of alluded to it early on. I think there's a couple of basic principles. The first is, there are many things in our lives that we can't control. And to persevere in things we can't control doesn't often necessarily move the needle. But there are lots of things, and I think the majority of things, and as you choose your profession, that you can control. And once I recognized early, even in high school, that I wanted to be a physician, a doctor, not knowing exactly what at that time, I sort of had the attitude that if anything gets screwed up, it's going to be my fault. In other words, I felt that if I try hard and was diligent, but at the same time kept a proper balance with exercise and social and everything else, but didn't screw it up where I would close a door otherwise, that was really important to me. I think it's a lesson when I talk to my college kids. I take care of a lot of youth and do a lot of mentoring. And I think young people have to understand that much of your future is truly in your hands. It's not that you can be anything you want to be in life. I was never going to be an NBA player. I'm 5'8". I was never going to be a professional football player, but I played sports, but I knew how far I could go, no matter how hard I tried. That being said, when it comes to sort of intellectual capacity and hard work ethic and integrity and learning when you put effort in, what you get back, and then also learning to be a consensus builder and work with other people and try to minimize the judgmental nature that all of us have and maximize your character. I felt that I was able to sort of remain opportunistic and to close the fewest amount of doors. So as a young person, no matter where you are in your training, I think it's really important to embrace what you think you have control over and just dig in. And we, as students who are going towards some postgraduate work, in many ways, we're really privileged because you sort of, unlike the person who's graduating college who's out there looking for a job, we knew once we got into school, we're going to school and you're in this tunnel, and the economics were not very important other than the fact that you just had to pay your bills, So that's what was particularly important. So from my perspective, I just needed to know I was in school and could keep going and doing the things I needed to do. Once I was done and getting in the job market and things were starting to come to fruition, I think, and it also speaks to how you build your practice, and making it easy for people to get access to you and always providing avenues. And it's easier now than ever. So, in my modern practice, my patients have my email, they have my cell phone number when need be, my website can easily reach out to me. I think what you learn in medicine is that it's more about the interpersonal aspects than it is about doing an operation or giving an injection or doing a procedure. You learn that people are complex, that they often need reassurance, they need education, and that's above and beyond anything you and I learned from a graduate degree or other. So I try to really teach that from a mentoring perspective, that people become a little more holistic in how they manage people, and never lose sight of that. Because I will tell you, being a doctor is the biggest privilege ever. There is never a day, even in these challenging times, that I go to work and say, I wish I was doing something else. It is absolutely a gift that keeps on giving. And I think all of us who are hampered, for example, with a period of time where we couldn't do elective work, most of the people that I spoke to who went through that shared very similar feelings when it was taken away from us, and we no longer could embrace that feeling of you want to help people, and that was taken away for a short period of time. The feeling of coming back to the table and again taking care of patients was actually very, very meaningful and eye-opening. And I think it built a lot of humility in all of us, because while we often say that medicine is recession-proof, it wasn't virus-proof, And I think there was a lot to learn. And I would tell you, just, I don't know if we'll get into it later, but, this period of time, I think I'm a better doctor now than I've ever been. And I've always thought I was a pretty good doctor, but I think I've learned a lot more, and I feel like I'm much better from lessons learned over the last 6 to 7 months.
What advice do you have for the graduating residents and fellows entering the professional job market for the first time?
Well, one issue is that most of us are victims of our experience. So they're going to have some perceptions of what life is like, perhaps based on where they've trained. I often tell young people that think about their mentors and their experiences as life's smorgasbord. In other words, you don't have to get the whole dish. You can take a little of this and a little of that. And one of the greatest privileges of training in a good program is that you're going to meet so many interesting people and learn how they're successful and learn about their failures. And it can help shape you. And you can, by taking little pieces of people around you who you meet, you can really grow your character. So I would say when you're training, the most important things are, I know you want to have a job in your sights, but think about the benefits of today. If we continue this focus on tomorrow, you're going to miss something very, very important. So in residency and fellowship, I think there's two issues. There's learning from those around you and picking the bits and pieces that are really meaningful to you, piecing them together to help mature you and move you forward. So that when you do come out and you are working and you have the opportunity to take care of patients, you can garner all the great things from the people that you've had the opportunity to interact with. The second thing is focus on decision making. All of us, for example, who become surgeons, we get to be better surgeons year after year. That's just by default. I mean, that's how we learn. We learn by practice, and training doesn't stop the day you finish your residency or fellowship. I'm always training. I'm always a student. That's one of the greatest things about being a physician, is that we never stop learning. The body of knowledge probably doubles every 3 to 5 years, for example, in orthopedic surgery. So just be a student and embrace that. That being said, decision-making, I think, is the hardest part. So being an active listener as a physician and learning to, the average physician interrupts their patient, I think, in 7 seconds, okay, before they even finish what they're saying. So there are certain methods that can make you a great doctor. Sitting down, the same eye level with the patient, never having your back to the door, take your hand off the door handle, always making sure that you've had the opportunity to ask them Did they have the opportunity to express what their major concerns were? What is it that they want to see get better? What are their expectations? What would they like to see different? And then if you order studies, make sure you look at those studies in the room and review them with the patient. And between then and the end of a visit, always asking the patient, is there anything that we didn't cover? Is there anything else you'd like to say? And you can do that type of interaction with a patient and learn that as a resident or fellow, and they will think you've spent 2 hours with them when it could be 3 to 5 minutes. The flip side of it is if you leave those elements out, you could spend 2 hours with a patient and they will think you were never in the room. So it is absolutely about the quality of an interaction that leads to a satisfying visit, both for you as a doctor and for the patient getting what they came for. Service is incredibly important in our space. In many ways, doctors have become commoditized, and your reputation really does matter, and it does help differentiate you. So when you come out into practice, most of your patients will be coming from some other patient. Now, mind you, they will almost all go to the internet and look for internet reputation and so forth, which is incredibly important. But even patients who are referred to me from other orthopedic surgeons, I know for a fact that they go online and assess and understand that. So then as far as the job goes, look, you have an open mind, you've learned what template you think works for you, but the job market every year is very, very different. And next year's job market, just because of what's going on recently, might be very different for a year. So I would say that orthopedics has enjoyed independent practice, non-hospital owned, if you will, or non-hospital employed, more than most subspecialties. We're generally about 30% hospital employed. If you want to be hospital employed, those jobs are out there. You'll have to choose if that's right for you. But if you are in any way entrepreneurial, value your independence, you're controlling additional sources of revenue, income, and so forth, I would say you should look for a private practice type job. Look for a private practice that's big enough, that has all of the infrastructure you need. Small practices are particularly vulnerable these days, because I think the best way to think about it is if you ski, think about a ski mountain. In order for them to open up, if one person's going to ski, you kind of have to have the same infrastructure as you would for 1,000 people, right? To open up a practice, there's a certain baseline of what has to be in place that is extremely costly, and it requires enough revenue generating doctors to support that practice. So when you look at the demands of compliance, the government, IT, HR, medical record, electronic medical record, outcomes assessment, the cost of doing business, the floor, is roughly the same just to turn the lights on, independent of the number of people in that practice. The vulnerability in practices are in small practices. It's not that they can't exist fundamentally, nor will patients not want to go to them. You physically, economically, it is very challenging to run a small practice because of the cost of doing business. That being said, if you're looking in the private or private academic milieu, having verticals and access to additional sources of revenue is incredibly important. Hospitals can pay you a good wage, and that's because they get the benefits of the downstream revenue that you provide as a surgeon to a hospital. So that could be operating room facility fees, that could be MRI, PT, the medical side, pharmacy, braces, DME. Hospitals get all of that for you when you're an employee. So you may say, well, my salary is pretty good. That's because they're getting multiples on the work you're doing from downstream revenue from patients. And you're getting paid often by an RVU basis. Alternatively, if you decide you want to go in private practice with or without academics, if you have the opportunity to enjoy the verticals, in other words, you control the patient, you do the best you can in being excellent at being a doctor, with or without surgery, just being a good doctor, and then also enjoy the business side that is acquired from the downstream revenues, if you will, that a patient really brings to the table. And that could be physical therapy, occupational therapy, MRI, CT, X-ray, DME, pharmacy, virtually every aspect of patient care you could potentially have some access to, and I believe do it better than others can do, because it's a much tighter environment.
What advice do you have for the graduating class this year, with most of these national conferences being canceled and really going online, and they're trying to figure out the whole networking aspect of doing it virtually?
We have, the world has changed, and we've heard that 1,000 times. We will bounce back to something that represents what we were like before, but I think there'll be some. I look at it more opportunistically and say, look, what good is going to come of this? I used to travel 25 to 30 times a year to teach nationally and internationally. I would fly to countries to give 2 lectures, turn around in 36 hours and come back. I would be away from my family. I would be away from my practice. It had a huge economic impact. It had an impact on my recovery. If you're an athlete, you understand about recovery, sleep deprivation, and all these other things that go along with it. It was enormous. I think that we can be very effective educators like you and I are doing today, and you can do it at your leisure. You can do it on demand. So a lot of that is going to be, I think, here to stay. You will be much more efficient. That being said, I think all of us feel the pain of the lack of personal interaction. And we're going to probably have to figure out when the world opens up safely, how we're going to achieve that balance again. But I think it'll be different. I think we won't forget the efficiencies gained of, I've often felt the meetings, certain careers, they say, well, look, we have to be face to face. And I never really understood it. I think now the technology is so easy that you and I can interact and have an effective interaction and actually get a business deal done. I could teach you something as effective as being next to me. I can review x-rays. I can review MRIs. I could interview a patient in front of you. So I'm pretty confident that I can deliver a high quality educational experience. We're going to be doing our interviews for fellowship virtually. This will be the first time ever. Probably we'll have some hiccups, but I feel pretty good about it. And I can split it into 2 nights, and I don't have to interrupt my day of work or interrupt my day with my kids or my family. And I can still go to the gym, and I can still have a couple of phone calls and do all kinds of things and shave off hours of the day. So I too, like all of us, get a little fatigued from these video conference calls and so forth. But I say net has taught all of us that we can be really effective and efficient at the same time. I think none of us, though, should be short-sighted in terms of what we've lost from the personal connection. There are a lot of people right now who are very isolated and may not even know it. There's a lot of mental health issues that you and I probably are unaware of, and people who are predisposed. So I think it requires all of us to have a level of sensitivity to understand what's going on in the world, especially in people who are very accustomed to having travel integrated into their lives and face-to-face contacts. I think there are benefits and psychological plays that people probably don't even know because it's just the way they function. And having that completely absent from their lives, I think it probably has a bigger impact than people recognize. I think the other point is why we still are navigating this uncertainty as we live with COVID. What I found particularly helpful is to make decisions and be definitive with those decisions. Because we kept saying, well, we have to be nimble, we got to be able to pivot. These are unprecedented times. We're all sick of hearing these terms. The bottom line is you and I spend all this time planning for something, and a week later, new information makes us change it. So I've learned that being definitive with a decision, look, if you're 40 to 50% sure of something, just make a decision and stick with it. Even if the world changes, at least you have a plan going forward. I think it's the lack of planning that has really introduced a variable that people underestimate. So we are used to being able to plan. We're a planning society, and we're all very busy and pretty sort of, our lives are relatively structured. We've lost a lot of that. And in an effort to remain nimble, we've lost a certain aspect of ourselves that leads to good productivity and a healthy psychology. So I would say the one thing I've learned is make a decision, stick by it. Even if you could have done something different, you're still going to make it it'll still be good. And I've learned that with my managing of the NBA, my association with Major League Baseball. I've managed independent baseball. By 1 week later, we weren't always perfect, but we stuck to it and we had a plan. And it seemed to help a lot in terms of actually getting things done and keeping people right side up in an otherwise pretty challenging time.
Can you talk about your involvement with the Chicago Bulls and the Chicago White Sox?
I've been the head team physician for about 16 years for the Bulls and a co-team physician for the Chicago White Sox. As head team physician, we're typically responsible for all things medical and working with the athletic trainer and strength and conditioning coaching. We deal with drafts. We deal with the combine. We deal with, obviously, with injury, a lot of medical issues, a lot of interpersonal issues, basically the entire spectrum of the health burden for a professional team. We also have to learn how to risk stratify, how to look at an athlete and assess risk for contracts, whether they're short or long. And we're not strategists. We can't be huge fans. We can't let any of that sort of get in the way of our decision making. And it's mostly based upon sort of interpersonal relationships and unadulterated commitment. It's been one of the most enjoyable things in my life, not because necessarily the ego gratification, but because it gives me balance. You and I didn't talk much about balance. And it's something that I always like to convey to residents and fellows who are learning. There's often an attitude that I'm going to work really, really hard now be a net saver, put in the bank, and then later on, I'll start to enjoy the things I really want to do in life. And sometimes that goes along with gaining 15, 20 pounds and not working out and not able to establish a healthy relationship with someone, not being a good enough parent, being available for your kids. You sacrifice a lot. And I'd say early in my career, I had some lessons learned that I became aware of, fortunately, very quickly. And I right-sized and right-sided myself early, and I think early enough, but it was all about balance. And whether it's physical or spiritual, intellectual or emotional, whatever leg of the stool you want to focus on, I would tell you that, and now we know this more now today than ever before, live for today and plan for tomorrow. And I'm not trying to be excessively philosophical, but as a resident or a fellow, we're so used to being in this tunnel. And while at the same time you're trying to be excellent and not screw it up and close doors, exercising that philosophy at the expense of your health and your interactions with others is going to also lead to compromise and a lack of opportunities. And it's also not sustainable. So I think you value those kinds of things rather than the balance in your checkbook or your checking account, and spending wisely, but trying to always be a bit of a net saver, planning for your future economically, working with smart people from a financial point of view, protecting your assets, aligning yourself with really smart people who can help you do that, because that's generally not our strength, and focusing on balance. And preserving time for yourself. Every Tuesday and Thursday is my time. I have a personal trainer that comes to my house because I save an hour rather than going to a gym. Even though I'll do that during the week, I know my time is 6 to 7 in the morning. My assistant doesn't schedule anything during that time. That's my time. I own it. And I've been able to live by that. There's a lot of other things I could share with you. And, if people are really interested, I've done a TED Talk on this topic, and it's on my website, Brian Cole, MD. But I have a lot of passion for sharing my lessons learned, because I was far from perfect, and I'm far from perfect now. But I think that all of us have something to share as we kind of learn along the way. And it's, again, that mentorship model. Let's all try to learn the greatest things that we've learned along the way. And our opportunity to give back is to share those with our young generation.
Can you touch on your involvement with the AANA?
I'm blessed to be the president of the Orthopaedic Association of North America. That we have a number of specialty societies and in orthopedics. The head organization is the American Academy of Orthopedic Surgeons. And I've been really lucky to have leadership positions in virtually all of those. But this is a unique time to be president of an organization that I have a lot of passion for. And the main reason that I have sort of taken a deep dive into the Orthopaedic Association of North America is that it recapitulates a lot of things that you and I are talking about, this concept of mentorship and helping young people who really want to do things and make an impact. I am largely who I am today because I had mentors who created a path that provided opportunity. They didn't give it to me. I still had to earn it, and I had to be excellent in what I did. And again, if I wasn't, it was my fault, not because there was any positive opportunity. Similarly, there's a lot of young people who are hungry for opportunities for leadership. And I meet people weekly who are amazing teachers and amazing thinkers. And I want those people to have an audience. So that AANA, the Orthopaedic Association, is actually that type of organization. We have historically been known for innovation, techniques. Now we're advancing towards performance-based assessments, meaning not only do you fill out a multiple choice test to say how much you know about something, but we're actually moving towards the way airline pilots learn how to fly with simulators and so forth. I mean, when would you ever expect your surgeon to watch someone for 4 years and then walk in the operating room and do the operation? There really is a disconnect there. And that's been historically, that's been our education. We have this other concept of sort of see one, then do one, and then teach one. And that's very important. And that is a very well-preserved tenet. But if you don't get enough frequency of seeing something, doing something, and teaching something, you're going to need a lot of that time when you come out to actually get excellent at what you do. So performance-based assessment and training is really important, something that we have not done a good job of in managing and policing ourselves. So we're good at teaching people how to take a multiple choice test. We're not so good at assessing skills. So skills training is another area that we're particularly invested in. And then finally, it's research. Research is really the pinnacle of progressing our field. As I mentioned earlier, orthopedics is replete with translational research opportunities. So giving people the tools to actually do a study, to collaborate, either a basic science study or a clinical study, and allowing them to to enjoy the benefits of being on a podium and teaching someone else, to publishing a paper, seeing their name in print, and knowing that they make a difference and they're being quoted for the work and their thoughts. That's incredibly ego gratifying. So I like to provide those kinds of opportunities for young people, and that's something I'm particularly committed in doing. And we don't only do that at our program at Rush, Midwest Orthopaedics, on a regular basis to our trainees. We can do this in a big way to our 6,000 members for the Orthopedic Association of North America. So it's a super huge privilege to be in a position of leadership, but it's not just me. I'm surrounded by amazingly intelligent people in the boardroom who all have a voice, and it's based on consensus, not just individual leadership.
Can you give us some insight into your podcast called Sports Medicine Weekly?
Years ago, I was in the locker room after a Bulls game, and I was talking to the voice of the Bulls, Steve Cashel. He had been managed Bulls radio for a long time, and he's got a great voice, and he's really good on radio. And I said, look, I've published 8 textbooks. I've more than 600 papers, and I feel like there's an audience I would really like to reach, which is more the layperson, because people come in the office and they always have questions. And I love either being able to answer them or being able to find the answers to their questions and being a resource. And I just started thinking, how can I reach more people? And there's a lot of ways to do that. And we decided then on ESPN that we would start a radio show called Sports Medicine Weekly. And we started 10 years ago. It was 8 years on ESPN. Now we're on the Score Radio Sunday mornings from 7 to 7:30. But more importantly, radio, only so many people listen to radio. This is a way to create a podcast that's reasonably edited, that's on YouTube, it's on Apple Radio, Apple Podcasts, Spotify, and the normal places that people go to hear podcasts. And my goal for the rest of 2020 is to really grow our podcast so that we can entertain people's questions, but also just deliver something that's really informative. It could be youth sports. It could be sports and nutrition. It could be the legalities behind sports. It could bring on a professional athlete. It could have nothing to do with professional athletes. It could be on tissue donation, on a lot of things on COVID, on how to remain active, how much fat you should have in your diet. Let's talk about cardiovascular disease. I mean, things that are like on everyone's mind. Those are the things that I want. That's really easy, digestible, and understandable. And so I have a lot of passion for it because it's another outlet for me to teach people. The other thing is we do have sponsors, and all the proceeds, everything for me is sort of a full circle in life. All the proceeds go to sport research, orthopedic research. So that actually makes it even better because we are secondarily supporting a mission to further the science of translational research in orthopedics.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.